Welcome to the deep dive. Today we're really focusing on a role that's just foundational, isn't it? The dental office front desk.
Absolutely. They're the first voice, the first face, kind of the command center for the whole practice.
Yeah, the air traffic controllers, as some say. We've been looking into some educational materials that really lay out the specifics of this role.
That's right. The responsibilities, the skills needed, it's quite detailed.
So our mission here is to unpack what these sources show us, to get past the surface level and understand why the front office is such a critical hub. We want to highlight some tasks and skills that honestly might surprise you.
Okay, let's jump in.
Where do the sources start?
Well, they're very clear right from the beginning. Front office people aren't just, background players. They are essential, absolutely essential for an efficient, smooth-running office.
Right, it's foundational.
Exactly. Their presence makes or breaks the flow.
And it's not just general skills. The sources specifically call out excellent organizational habits and really strong communication skills, like non-negotiables.
Totally. And beyond those baseline traits, what comes through is the need for some pretty specific knowledge.
Yeah.
Things like preparing insurance claims, which isn't simple.
No, that involves coding, benefits coordination, tracking.
Yeah.
It's complex.
Right. And maintaining schedules. The sources use specific words here. Competent, well-organized, cost-effective, and efficient schedules.
That efficiency part is key, isn't it? It's more than just filling slots on a calendar.
Way more.
Okay, so speaking of first contact, the telephone, the sources put a huge emphasis on this.
They really do. Handling calls professionally, but also with compassion.
And here's where it gets really interesting. The materials state pretty bluntly that for a new patient calling in, how that call goes is often the deciding factor.
Yeah, the determining factor, they call it. Whether they book with you or just hang up and call someone else.
Wow, so it's literally the make or break moment.
It can be, that first impression.
And it demands more than just a pleasant voice, right?
Yeah. Oh, definitely. You need that pleasing personality, sure, but also the skill to capture all the necessary information accurately and, efficiently.
Pertinent information insurance details, the reason for the call.
Exactly. All during that potentially brief interaction.
Okay, so you've handled the call well, they're interested. What's next, according to these materials? Scheduling seems like a big one.
Huge. It's described as a very complex undertaking.
Requiring a great deal of knowledge and finesse. Okay, why so complex?
Well, the sources explain the core challenge.
Yeah.
You've got to set the doctor's schedule to give the right amount of time for each patient, for each specific procedure.
Right, to keep things moving efficiently without dead time, which costs money.
Exactly. But, and this is the tricky part, you also have to avoid overbooking.
Ah, the classic problem. Long waits, unhappy patients.
Stressed out clinical staff in the back. It's a really delicate balancing act.
Finding that sweet spot.
Yeah. The goal they outline for an ideal schedule is creating this efficient flow. Minimize waiting, maximize productive work.
And how do they achieve that? It can't just be guesswork.
No, and this is a critical point the sources make. You need a basic understanding of dentistry, of the procedures themselves.
Ah, okay, so you can't effectively schedule if you don't know roughly how long things take.
Precisely. You need to know that, say, a crown prep takes way longer than a simple checkup, or involves lab time, multiple visits.
You can't just put patient Smith 30 minutes for everything.
Exactly. You need that clinical context. It's not just admin, it's practice management, informed by clinical understanding.
That makes sense. And that understanding presumably extends to the whole patient journey, like check-in and check-out.
Absolutely. Let's walk through check-in, based on the materials.
Okay.
So patient arrives. Front desk is the first face they see. The sources stress that warm, welcoming greeting. Super important.
Sets the tone. Then what? Forms for new patients.
Yep. Collecting all the completed forms. And for everyone with insurance, getting that card, copying front and back. That's crucial.
And front and back.
Often different info, group numbers, subscriber IDs, contact numbers. You need it all. Then, the really key step before they even sit down in the operatory.
Wait, verifying insurance.
Yes. Verifying current benefits, usually done online or maybe a quick phone call.
And why is that timing so critical right at check-in?
Because, the sources explain, this is when you inform the patient roughly what today's appointment should cost them based on those verified benefits.
Ah, setting expectations up front, financially.
Exactly. Manage expectations early. Then you welcome them to the waiting area.
Okay, so treatment happens, then they come back to the front desk for checkout.
Right. And this is where they collect payment.
And make any needed follow-up appointments.
Correct. And the sources make a point to connect this back to check-in. They state very clearly, there should be no confusion or surprise about the amount owed now.
Because it should have been discussed before treatment started, based on that verification step.
Precisely. It closes the loop, builds trust, avoids awkward or difficult conversations right at the end.
Yeah, you don't want payment issues souring the whole clinical experience they just had.
Nobody wants that.
Yeah.
Financial transparency up front is key.
Okay, another big interaction mentioned is presenting the treatment plan. Can be tricky.
Definitely. So the plan itself is usually generated after the exam. Dentist dictates findings, maybe an assistant enters it into the software.
And it lists everything. Necessary treatments, costs, priorities.
From a simple cleaning maybe, all the way up to complex crowns, bridges, implants, whatever's needed. Listed out, often prioritized.
And the front desk's role is presenting this printed plan.
Yes. And the materials suggest a best practice here. Do it in a private area.
It makes sense. Away from the busy reception, other patients.
Right. Allows for focus, privacy for financial discussion, answering questions without an audience.
Do they mention tools to help with understanding? Sometimes dental work is hard to visualize.
They do. They mentioned using things like models, diagrams, visual aids to help the patient really grasp what is being done and why it's necessary.
That educational piece is important. Now, what stood out to me was a specific detail about who explains what.
Yes. The sources clarify that while the front desk handles presenting the plan itself, the list of procedures, the costs, the insurance estimates, it's actually the job of the dental assistant back in the clinical area to make sure the patient understood the procedure itself, the why and how of the actual dental work.
Interesting distinction. So front desk handles the logistics and financials of the plan.
Right. The what and how much.
While the clinical assistant confirms understanding of the actual dentistry.
Yeah, confirms the why we're doing this specific thing in your mouth. Part was clear.
Yeah.
It highlights that need for seamless collaboration, a good handoff between clinical and admin.
Got it. Everyone needs to be on the same page, especially the patient.
Absolutely.
Wow. Okay, so stepping back and looking at all this. Greeting, that incredibly complex scheduling, managing the whole check-in, check-out flow, insurance verification, financial discussions, presenting treatment plans.
There's a lot to juggle.
It really is. It's far more dynamic and, frankly, demanding than I think most people realize.
I agree. The sources make it clear it requires this unique mix. You need great interpersonal skills, obviously, but also serious organizational ability, meticulous attention to detail, and this specific functional knowledge of the dental business and even basic clinical procedures.
It really is the central nervous system of the whole practice, isn't it?
That's a perfect way to put it.
So maybe here's something for our listeners to think about. The next time you're at your dentist, maybe sitting in the waiting room or talking to the front desk staff, knowing all these different hats they wear, all the details they manage behind the scenes, what might you notice differently? What new appreciation might you have for just how crucial their work is to your entire experience there?
That's a great takeaway. It really changes your perspective on that role.